Hello, good morning, viewers. You're welcome to today's series with Dr. Sam of the Health Sentinel. And this morning, we'll be talking about suicide. Every year, 703,000 people take their own life, and there are many people who attempt suicide. Every suicide is a tragedy that affects families, communities, and entire countries, and cause a long-lasting effect in the people that are left behind. And suicide occurs throughout the lifespan and was the fourth leading cause of death among the people between the ages of 15 to 29 years old globally in 2009. And suicide does not just occur in high income countries but a global phenomenon in all regions of the world. In fact, over 77% of global suicide occur in low and middle income countries. And we're going to look at who is at risk of suicide. While the link between suicide and mental disorder, in particular depression and alcohol use disorder, is well established in high income countries, many suicides happen impulsively in moments of crisis with breakdown in inability to deal with life stresses, financial moments, relationship breaks up, and chronic pain and illnesses. In addition, experiencing conflict, disaster, violence, and abuse, loss, and sense of isolation are strongly associated with suicidal behaviors. Suicide rates are also high among vulnerable groups of people experiencing discrimination, such as refugees, migrants, indigenous people, lesbians, gays, bisexual, transgender, intersex, generally the LGBTI persons, and prisoners as well. By far, the strongest risk factors for suicide is a previous suicide attempt. Well, talking about the method of suicide, it is estimated that around 20% of the global suicide are due to pesticide self-poisoning, most of which occur in rural agricultural areas in low-income and middle-income countries. Other common suicidal methods are hanging and firearms. Okay, knowledge of the most commonly used suicide method is important to devise prevention strategies and also shown to be effective, such as restriction to access to means of suicide. Now, stigma, particularly surrounding the mental disorder and suicide, means people thinking of taking their own lives who attempted suicide are not seeking help and are therefore not getting the help they need. The prevention of suicide has not been adequately addressed due to lack of awareness of suicide as a major public health issue and a taboo in many societies to open up and discuss about the attempt. To date, only few countries have included suicide prevention among their health priorities, and only 38 countries report having a national suicide prevention strategy, according to the WHO. Talking about the prevention of suicide, suicides generally are preventable, although it's very difficult. There are a number of measures that can be taken at population, subpopulation, and individual levels to prevent suicide and suicidal attempts. Live life approach by WHO is a suicide prevention recommendation of the following evidences that has been helpful in the prevention of suicides, and some of them are to limit access to the means of suicides, like the pesticides, the firearms, certain medications, to interact with the media for responsible reporting of suicide, to foster social emotional life skill in adolescents, and early identify, assess, manage, and follow up anyone who has affected by suicidal behaviors. This needs to go hand in hand with the following fundamental and foundational pillars. Okay, other ones are the situation analysis, multi-sectoral collaboration, awareness raising, like I'm doing right now, like the Health Sentinel is doing, capacity building, financing, surveillance, and monitoring and evaluation. Suicide prevention is difficult, like I said earlier, and the prevention efforts requires coordination, collaboration among multiple sectors of society, including the health sector and other sectors such as the education, labor, agriculture, business, justice, law, defense, politics, and the media. These efforts must be comprehensively integrated, as no single approach alone can make an impact in an issue as complex as suicide. Dear viewers, please feel free to talk to someone who has a suicidal attempt, to reach out to the Health Sentinel, Dr. Sam, for help. Our contact line is displayed on our YouTube handles and on our social media pages, our Instagram. So feel free. Thank you very much for listening and for viewing. God bless you.